Imagine this. You're about to undergo a medical procedure. You're there, maybe a bit nervous, but, trusting the process.
Mm-hmm. Standard stuff.
Then something from your past, something you barely even think about, maybe a scorpion sting from years ago, suddenly becomes critical.
Right. Something you dismissed.
Exactly. What if that brief moment of pain actually had these lasting, really significant implications for your health, especially during something like anesthesia?
That's a really startling thought.
Welcome to the deep dive. Today we're digging into a stack of medical research, some fascinating case studies too, all focused on a surprisingly complex topic: scorpion envenomation.
Yeah, and not just the immediate bite.
No, not just the emergency room visit. We're looking specifically at its surprising and honestly crucial role in the operating room.
The anesthetic implications.
That's it. Our mission here is to unpack these profound, often overlooked connections between a past scorpion sting and anesthesia. We want to give you that shortcut to being well-informed with some pretty surprising facts and practical insights.
Definitely some things that redefine what you might think you know about these creatures.
Okay, so let's open up these sources we've gathered. When most people think scorpion sting, you picture immediate pain, right? Maybe a trip to the ER.
An acute event. Pain, swelling, maybe some local reactions.
Right. But what our research is showing is that for anesthesiologists, well, encountering a patient with a history of a scorpion sting isn't really an if, it's more of a when.
Especially depending on the part of the world we're talking about.
And what's truly eye-opening is that this past sting doesn't just present one challenge. Our sources point to two distinct, significant hurdles that go way beyond that initial bite.
You're absolutely right.
Mm-hmm.
And what's particularly striking looking at these papers is the sheer scale of this issue globally.
It's not just a rare occurrence.
Not at all. Scorpion stings are, well, a daily reality in many parts of the world. We're talking Latin America, North Africa, the Middle East, India.
Huge areas.
Huge populations. The sources estimate over 1.5 million envenomations happen every single year worldwide.
Wow, 1.5 million.
And tragically, this leads to roughly 2,600 deaths each year. Mostly the research points to stings from species in the Buthidae family of scorpions.
The Buthidae family, okay.
So this really isn't some niche, obscure medical problem. It's a substantial public health issue, and it has these often hidden consequences for anesthesia practice.
Right. So let's get into those consequences. One of the first challenges we found discussed quite a bit in these medical papers, and it's pretty perplexing, is something called local anesthetic resistance.
Ah, yes, this one's fascinating.
So what this means for you, if you're the patient, is that if you need a procedure needing only local numbing, say a spinal block for surgery below the waist.
Or maybe an epidural or just numbing for stitches.
Right. The usual dose of that anesthetic, the lidocaine or whatever they use, it might just not work as expected. Or maybe it wears off way faster than it should.
It's almost like your body has developed this unexpected shield against the numbing agent.
A shield? How? What do the sources suggest is going on there?
Well, they offer a couple of main hypotheses for why this happens. The first involves the venom itself. Specifically, it's neurotoxins.
Chemicals affecting the nerves.
Exactly. These neurotoxins might actually cause long-lasting changes in your nerve cells' sodium channels. You can think of those as tiny gates controlling the electrical signals in your nerves.
The on-off switches?
Kind of, yeah.
Yeah.
And if these gates are altered, maybe they don't close properly or they're just different somehow, the anesthetic, which normally works by blocking these gates, becomes less effective. It can't do its job as well.
So the nerves just aren't responding to the numbing medicine like they're supposed to.
Precisely. That's one theory. And the second one is also really interesting. It might involve your own immune system.
How so?
The idea is that your body could produce antibodies against the scorpion venom, which makes sense, right? Your body trying to fight it off.
Sure, standard immune response.
But these antibodies, in a sort of cross-reaction, might accidentally interfere with the local anesthetic. They might actually block the anesthetic molecule from binding to its target site on the nerve.
Wow, so your body's own defense mechanism inadvertently gets in the way of the medication.
That's the hypothesis. It renders the anesthetic less effective, or maybe even useless in some cases.
That is definitely a wild card if you're the one administering the anesthesia. Okay, so that's local resistance. Now, the second major challenge seems, well, potentially much more dramatic.
Mm-hmm.
It involves systemic instability, especially under general anesthesia, when you're completely put under.
Yes, this is where things can become truly critical very quickly.
The papers talk about patients experiencing something called an autonomic storm. That sounds Intense.
It is. An autonomic storm basically means your body's involuntary control system, the autonomic nervous system, which manages heart rate, blood pressure, breathing, all the things you don't consciously control, it essentially goes haywire.
It just loses control.
It's like a chaotic surge of signals. It can lead to these wild fluctuations in vital signs. Sometimes you see this dangerously overactive state, doctors call it hyperdynamic, where the heart is pumping way too hard and fast, blood pressure skyrockets.
Okay, that's bad.
But it can swing the other way towards a profound weakening of the heart muscle itself that's called myocardial depression. And you can also get fluid buildup in lungs or pulmonary edema.
So it's like a roller coaster of vital signs that could become life-threatening really fast.
Exactly that. The massive challenge for the anesthesia team is managing these unpredictable, severe swings in real time.
What else might they see?
Well, besides the blood pressure issues, you can get abnormal heart rhythms, arrhythmias. These patients might need immediate, really aggressive support medication, sometimes ventilation support, just to keep their heart and lungs functioning properly.
This is all from a sting that might have happened years ago. Incredible.
It shows how potent these venoms can be and how long-lasting their effects or the body's reaction to them can be.
So, okay, let's sort of synthesize this. What does this all mean for us, the listeners, and maybe for any medical professionals tuning in?
Yeah, the practical takeaways.
Our deep dive into these sources, it's clearly shown that a scorpion sting, even one from way back, it's definitely not a trivial detail in someone's medical history.
Absolutely not.
It's a really significant warning sign. A flag for those two distinct and pretty serious anesthetic challenges we talked about. First, that confusing resistance to local anesthetics.
Making regional blocks unpredictable.
Right. And second, the potential for that really scary, life-threatening systemic instability under general anesthesia, that autonomic storm.
Affecting the heart, the lungs, blood pressure, the whole system.
So connecting this to the bigger picture, what should be done?
Well, I think it really underscores the absolute necessity for vigilance during the preoperative assessment.
Before the surgery even starts.
Exactly. Anesthesiologists, and really anyone involved in that pre-op evaluation, need to maintain a high index of suspicion. They need to conduct a thorough patient history.
I'm part of that history now.
Definitely needs to include asking, very directly, have you ever been stung by a scorpion? It seems simple, but it could be critical information.
And if the answer is yes,
then you need to be prepared to adapt the anesthetic plan. Maybe that means choosing general anesthesia over a regional technique if you're worried about that local anesthetic resistance.
okay.
Or if you suspect a history of more severe systemic envenomation, or if the patient comes from a region known for dangerous scorpions, you need to be ready to implement aggressive hemodynamic and ventilatory support from the get-go. Be prepared for that potential storm.
Having the right drugs, the right equipment, the right mindset, essentially.
Precisely. Being proactive rather than just reactive when things go sideways.
You know, this raises a really interesting final question, I think. If a past scorpion sting, something seemingly isolated, can have such profound, long-lasting effects on how our bodies react to critical medications like anesthetics,
Oh, yeah.
what other seemingly small or maybe forgotten details in a patient's medical history might be holding surprising, critical information for their care? Things we don't routinely ask about, maybe.
That's a powerful question. It really makes you think about all the hidden stories our bodies hold, doesn't it? All the past encounters that might still be influencing our physiology today.
It really does. A lot to consider there.